Oh boy, it's coronavirus data 532, the phase 3, day 42, and we still have an alarming high coronavirus cases. Oh no, yeah, yep, yep. So still in 6,000s, 600s, with the 6,678. Okay, so just like 17 more than compared to yesterday's number. So yeah, it's just a small jump, but yeah, it is. Yeah. So Toronto, as usual, is in the lead with 144 cases. 102 from the Peel region, 97 from York region, 78 from Windsor-Essex region, and 51 from Durham region. All other regions are reported under 50. High number. No deaths have been reported today, so that's okay. Uh, so first though, the vaccine shot is 75.5%, and fully, yeah, yeah. So if that's fully vaccinated, and yeah, so even though yeah, the requirements have been met, the only thing that's really keeping us behind is the India variant and the high cases. So that's also yeah, also a case yeah. Yeah, yeah, okay. So, vaccine info on phase 3 and phase 4 information down below. Okay, but today's topic is has to do with wave 4 of coronavirus. So, with the coronavirus case numbers being very high in Alberta, British Columbia, and Ontario, with Alberta and British Columbia being the highest, and Ontario, of course, you've seen it, it's pretty high. So health experts are worried about that Canada could be going the worst wave of coronavirus yet. So, because we already had to deal with wave 3, which was, yeah, pretty very troubling, but yeah. So, Dr. Joe Vipand, who's the emergency physician and a Calgary and co-founder of the Masks for Canada, so he said we're in big trouble. And he said this calculation that show that Alberta's case numbers are doubling roughly every 11 days. So yeah. So if that continues, he said Alberta could see 1,200 new cases per day in early next month, and 2,400 in the middle of the mid-September. So yeah, that's trouble. So Dr. Shazma Vitani, who is an emergency doctor at Edmonton Royal Alexandra Hospital and Stollery Children's Hospital, mentioned that there's definitely a notable increase in number of coronavirus patients that are coming into the hospital in the last 2 weeks or so. So opening schools again in September, so that becomes an issue, and especially the children who cannot be vaccinated. So Alberta reported like 744 cases on August 19th. So British Columbia, yeah. So in British Columbia, they have reported that cases are doubling per 9 days. So yeah, so that's also trouble. So a mathematics professor at the University of British Columbia and member of the modeling group, Dan Coombs. So he said the province could see that 10,000 cases per day. So yeah, and the cases could soon exceed record levels in British Columbia. So, and because of that, British Columbia became the third province to require proof of vaccination. So starting September 13th. So yeah. Yeah. So the British Columbia Modeling Group expects that many cases will be from coming from young children. So yeah. So then in Ontario, Dr. Alison McGreer said there could be 7,000 cases per day mid-October. Who the infectious disease physician and Sinai Health System, Mount Sinai Hospital. And also mentioned the India variant there, that one main cause. So Dr. Vipon said that we need to do more than just vaccinating people. So, however, people we were told that the pandemic would end with vaccines. However, we need to do what you need to do. We shut down mass gatherings and need to close indoor dining for a period of time, according to what he said. And so it's not just vaccines. Because if we just rely on vaccines, vaccines are sort of tools to sort of help, but it won't be the exact thing that will actually end it. So it won't be one of the things that'll sort of narrow it down, but yeah, other things can also be. I see what Dr. Vipand is actually saying, so yeah, we need to also do other things that can. And people can need to stop having a large gathering and also take precautions. So Dr. Allison McGreer mentioned we're not. Said it was nice that people had to a little break in the summer, but so not to nothing, not to have another lockdown, but back from whenever, yeah. So that's proof enough. However, Dr. Alexon McGreer said even though Canadians are frustrated at the point that the pandemic is and they just want to go back to normal, however, that doesn't matter. And she said it's a virus, and the virus does not care what you and I think. It does not care how tired we are dealing with this. It does not care about anything except going on its merry way, infecting people. And she mentioned if we don't do something about the increasing number of cases, we're all going to push the healthcare system over the limit again, and people will die. And I can see Dr. Allison McGear's point there, because also hospitalizations and ICU numbers and yeah, are pretty high. And of course, though, the hospital, because the last couple of months, hospitals had to some hospitals, they were so full with the coronavirus patients, they had to send some coronavirus patients to other provinces like Ontario, and certain hospitals where rooms were emergency rooms were actually they actually had hospital beds, so they actually treat people. And who knows if that's going to happen again. So a lot of people from Manitoba got sent over to Ontario, and from all the way from southwestern Ontario to sort of northern Ontario to out east of Kingston. And don't forget, their outbreaks have happened at hospitals too. So that's also another thing that we need to watch out for. Yeah. And that was because of coronavirus cases. So yeah. Anyways, hospitalizations. I'm not surprised that 302 people are hospitalized with coronavirus, plus 19 compared to yesterday. 165 ICU patients, plus 4, and 134 ICU patients using a ventilator, also plus 4. No long-term care home deaths, staff and outbreaks have changed. The same numbers as yesterday. So yeah, long-term care home deaths have not changed since August 5th. Staff deaths have not changed since May 15th, and outbreaks, August 20th, 25th. So please follow coronavirus safety rules and regulations and PH3 rules. Please be careful due to the India variant, and also because we're really in deep water, and of wave 4 of coronavirus. This is no joke, and yeah. So not just getting vaccinated, but also other things like not having super really large gatherings. Otherwise, we're gonna have to cancel some things out. we won't have another like lockdown or anything, but I mean, we haven't even reached wave 4, like phase 4 yet, so yeah. Which is pretty embarrassing, so yeah. So I suggest getting vaccinated and do your part. Maybe hopefully coronavirus cases will go down, and we can move on to phase 4. Stay safe.